Welcome to Why I Vaccinate, presented by the Franny Strong Foundation and the Michigan Department of Health and Human Services. I'm Ann Thomas, and I am here with my co-host, Veronica McNally. And Veronica, we have two great guests to start off this show today. First of all, we have Bob Swanson, the former director of the Michigan Division of Immunizations. And we are also joined by Terri Adams. She's a registered nurse, and she's the interim director of the Michigan Division of Immunizations. Thank you both for joining us today.
Thank you.
Thank you.
And Bob, let's start out with you. You had this job as the head of the Michigan Division of Immunizations for 33 years. Talk a little bit about the history of childhood vaccines.
Well, I think childhood vaccines have really grown in importance because we now protect children and adults against so many vaccine preventable diseases that we weren't able to before. So we've added new vaccines to the schedule to be able to protect people from these very, very serious diseases and prevent them from getting ill or even dying. And so even since I've been with the program or was with the program, it has grown tremendously.
Can you just explain what are the required vaccines right now in this state in 2021?
So I think it's important to note that we do require some vaccines for childcare and for school, but that doesn't mean that we shouldn't look at the vaccines that are recommended across the board for all children. So the vaccines that we require for school are diphtheria, tetanus, pertussis vaccine, polio, hepatitis B, measles, mumps, rubella, varicella, and pneumococcal for childcare. But there's other vaccines that are very, very important, such as hepatitis A and HPV vaccine that we should all be getting to be sure that we're fully immunized, as well as the annual flu vaccine.
And this question can be for Terri or Bob. Michigan was one of the first in the nation to create an immunization registry to help providers protect their patients through reliable records. Talk a little bit about Michigan's role in this. This is pretty impressive.
Well, Bob really was one of the founders in our Michigan registry. It's a Michigan Care Improvement Registry, and it is so vital to collecting the immunization data throughout our state, and providers really have grown to depend on this registry. We use it on our daily basis now more than ever with our COVID vaccinations to collect that information as well. And as you know, it has grown throughout the state, and many other states now really look at our registry and think, wow, I wish we had that in our state. But we use it so that providers, no matter where a child, adolescent, or adult goes throughout our state for healthcare, they can access that registry and find out if this person has been vaccinated, if they need vaccines, if they're up to date, and so that a person doesn't get over-vaccinated, or to make sure that they're up to date with their immunization. So it's vital. It really is vital, and it has proven to be beneficial over and over again and again. And so we're so thankful that providers use this. They can use it with their electronic medical record. Health systems are using it. We populate it with our electronic birth records, so it's there from the start. And it's just really, really grown to be such a great benefit for our state.
Terri, can you tell parents how they can get a copy of that record for their children?
So important. They can get a copy of their immunization record from their healthcare provider. First of all they have to do is ask. Healthcare providers have access to our immunization registry. They can also get it through their local health department. And then their last resort is to contact us at MDHHS and prove that they are the parent, and we can get that to them through mail. But that is a cumbersome process, but we can certainly do it. But their healthcare provider would be their first resource for sure.
We've gone through, I think I would phrase it as maybe stages in Michigan, where we've had lower immunization rates and much higher immunization rates. So let's just talk about that for a minute. When we are at a high point of vaccination rates for children, what would you attribute that to? What efforts?
I think it's a combination of efforts. It's certainly not MDHHS doing it alone. We certainly support and encourage immunizations throughout the state for parents, but it's really provider effort, local health department effort, parents understanding the importance of vaccinations, community effort. But it's a group effort. But we have to understand the importance of getting kids vaccinated, adolescents vaccinated, so they go through their adulthood protected. But adults need vaccinations as well. So it's a lifelong process. Immunizations don't stop when we become adults. But knowing the importance of going back to school this fall in person, we have to get our kids protected if we want to get back to normal. And part of that is getting vaccinated. So right now we are at an all-time low for our immunization rates. We are at 69.3 for immunization rates. In a year and a half ago, when we began this pandemic, we were at 73.6. So that's a huge decrease for our immunization rates. Really concerning if we want to get kids back to normal and back in school. So we have to work throughout the summer. Parents need to make appointments now because they're going to fill up to get appointments and get kids back into their provider offices and get them back on schedule and up to date. We have to work together, MDHHS, local health departments, provider offices, community health centers, all of us to get kids back on track. So important.
Well, you mentioned that vaccination rate, and I don't think that everybody understands the significance of that number when we're talking about the ability for a disease to spread in a community. Can you talk about community immunity and threshold levels necessary to prevent the spread of disease?
Sure. So when we talk about a community immunity, we're talking about herd effect, and we need a certain level of protection across the community before disease can spread easily. And with measles especially, we're especially concerned because we need a high rate of that number or that protection before measles will spread. And right now we don't have that. We have a very low level of protection for measles in our children, especially school age or preschool levels. And we're extremely concerned that we will have a measles outbreak in children. We had a measles outbreak recently in the few years past of adults, and that spread quite quickly amongst unvaccinated adults. And if we have an outbreak amongst children and unvaccinated children, that's very concerning because measles can be serious amongst children. And we need a very high level of protection among children, around 95 to 98%, and we only have around 80% protection right now in our children. So that's a very low number for children to be vaccinated to have that level of protection. And Bob can speak to this too. We're extremely concerned in Michigan about that number.
I think that one of the reasons why sometimes low levels dip is because of misinformation in a community. People have maybe some thoughts that they've heard from family members or media, and they're not really sure what to do with the information, and so they go online. And when they get online, there is not always a high quality level of information, and that can be a problem. So I wonder, Bob, if you can talk about sort of the dangers of misinformation and where people can go for good quality information when they have questions about vaccines.
Absolutely. Yes, misinformation, I think, is a huge cause of under-vaccination, where individuals don't get vaccinated because they don't have the right information about vaccines. The short of it is vaccines are very safe and they're effective and they do the job of preventing disease. So if you do have questions about vaccines, I strongly encourage several resources that you can go to. One would be CDC. You could go to CDC to look at their resources that they have. Those are scientific, fact-based resources. The Michigan Department of Health and Human Services has a lot of resources available. But most importantly, and I think right now a very good resource is Vaccinate. Ivaccinate.org is a website that has fact-based immunization information. It there to support parents on their decision-making about vaccines and the importance of vaccines. So I would strongly encourage going to ivaccinate.org.
And Bob, you've got so much history with regard to vaccines. Why do you think we are seeing a decreased number of people getting vaccinations for their children?
Right now, I think, so we just touched on a big point, is that there's misinformation, I think, about vaccines. And people really need to make an effort not just to believe what they're reading online, unless it's a credible source, and they need to go to credible sources. But also, I think COVID has really played a huge role in why our rates are low right now. A lot of parents quit going to their well child visits for their children and even their own visits for vaccines. And so our rates have dropped off tremendously due to COVID. We really need to, as Terri talked about, put a strong effort into increasing our immunization rates, getting those rates back so that we have that community immunity that Veronica talked about, to be sure that we can't spread the disease within the community, and others will protect others from the disease if they're not immune for whatever reason. But that rate needs to be high.
And Bob, what role does the anti-vaccination movement play in all of this?
Well, I think it plays a big role because they propagate many times misinformation, and that's not a good thing for us. We need to make sure that the information that's being talked about is credible, that it's science-based, and it's factual. And some of the information that we see going around is not always that way. And so when that information is pushed out, it only gets into the wrong hands, and people then don't get vaccinated. Our community needs to have strong confidence in vaccination. It is a very safe and effective tool that we have to prevent diseases. So people need to take advantage of those credible websites like ivaccinate.org.
Bob Swanson, former director of the Michigan Division of Immunizations, and Terri Adams, interim director of the Michigan Division of Immunizations. Thank you for your time today and for the really great information. We appreciate it.
Thank you.
Thank you.
You are listening to Why I Vaccinate. Coming up next, we are going to talk with two doctors working every day to make sure their patients are vaccinated and have the information they need to make informed decisions. We'll be back right after this.